Hi there, it's Dr. Joel with Life Clinic in Eden Prairie, and one of the conditions people present to our clinic with is vertigo or dizziness. And there's different kinds of dizziness. One is called positional vertigo, one is cervicogenic or neck-caused vertigo, and then there's other causes or potential causes for dizziness. So really finding the root cause is the key. Now, one of the most common ones is that positional vertigo that I mentioned, BPPV, which stands for Benign paroxysmal positional vertigo. And most often people notice the vertigo when they turn their head into a certain position, kind of like rolling over in bed or getting up from a seated position to a standing. Different head positions can change how their dizziness is or when they notice it most severely. And there's different positioning exercises that can be done in order to correct this. And I'm going to show you one of those in a minute. But that has to do with the orientation within the inner ear of the canals in the ear in relation to a center part called the utricle. And what happens is in the utricle there can be debris that breaks loose and then floats through these fluid-filled canals within our inner ears. And inside those canals are many sensory hairs or sensory nerves that then give feedback about the position of our body. And when those bits of debris clump together, they can form like a sediment that then is enough to jostle those sensory hairs and send a haywire message to our brain that our body's spinning around when it's really not. And that's where the vertigo or the sense of dizziness comes from. So basically what we want to do is, based upon the position of the head and which direction causes that dizziness, is turn the head into certain positions to reorient and allow the debris to then float down those canals back into that center position, basically bring that back to where it needs to be to then prevent the dizziness from occurring. So I'll show you that repositioning exercise. Learned it from a medical doctor named Carol Foster, and it's very effective. It's been very effective with different patients. I'll show you that here. And you're going to tip your head back into extension. And that allows any debris to float into this back position, and you want to wait for it to settle. And if there's any dizziness symptoms, you just wait for those to subside in each of these positions. So right now, as the dizziness stops, what she's going to do is drop forward, tucking her chin down so she's looking back at her knees and ankles. And that again allows the debris or crystals to float forward and settle into a different position. And then if she has more symptoms to one side, she's going to turn her head to the affected side, in this case her left. So she's going to look at her left elbow or knee, and what this will allow the crystals to do is fall into the proper canal. And again, she's going to wait for the symptoms to subside. Next, she's going to lift up into a neutral position, keeping her head turned. But in this position, we want her head to be level with her back. And now, the next step after the dizziness stops is to rise back up into the kneeling position, keeping her head turned. And there you go. So that's the repositioning exercises for vertigo.